Hey guys, this week we're talking about prescription drug abuse, and we got 4 different questions we're going to talk about. So the first thing we'll talk about is what assessment findings may indicate substance abuse related to opiate use in the pathophysiology. So some signs and symptoms of opiate overdose we'll talk about, or not overdose per se, but overuse, is constipation, depression, decreased blood pressure, decreased respiratory rate, confusion, and poor coordination. Some of the things we may see in the acute care setting in a hospital would, is that classic, they've taken too much pain medicine, they've been on the PCA too much, or they've been, having a lot of pain, so they've been on the call bell and getting their, pain medicine, Q4 or whatever, and they're desatting on the monitor, and they're, bradypneic. So these are the patients that you're going to roll in with some Narcan and start giving a dose of Narcan. The Narcan competes for the same receptor sites as the opiates and doesn't allow those opiates to bind to the receptors and have the effects that they have. So opiates are depressants, so they're going to slow all the body systems down. Elderly populations, your big problem you have with them is they get bowel obstructions from constipation. So it's important that we're doing the right things for their care too. But so for patients that are abusing that, you may see those signs and symptoms. Also, what behaviors do patients demonstrate when abusing prescription medications? These are the patients that your ED nurses in the bunch will definitely see these patients as they're frequent flyers. They're constantly in the ED. They're stealing or forging prescriptions, which is certainly illegal. So they're writing their own prescriptions on prescription pads. They're taking higher than prescribed doses. So they obviously, math there that comes out is that they're going to run out of their medication before they get a refill. They may have sleep cycle disturbances, whether they're sleeping all the time or they're suffering from insomnia, poor decision making. They lose their prescriptions. Or they come in, their own, codeine prescription, and they're seeking something else, whether it be another pain med or another sedative of sorts. So those are some of the kind of things that should flag to us that these patients are abusing their prescription medicines. So what are some of the best practice interventions that healthcare providers may implement to manage prescription drug abuse? Much like I found out in preparing my notes for this, so much like depression, where it was focused on counseling and medication therapy, for prescription drug abuse, it's really big that we provide coping and support for these patients, either through a 12-step program, much like Alcoholics Anonymous. They have Narcotics Anonymous, church groups, other support groups, or employee assistance programs. That's a big focus, is that we're working with these patients to get them the therapy that they need, as well as just the other side of that is putting them on methadone and starting to wean them off, because they've moved from a psychological dependence on these medications to a physiological. So you just can't stop taking, after all these years or months that they may have been on opiates, they just can't quit cold turkey. So it's important that we wean them off with methadone to kind of decrease that body's physiological need over time, or physiological need over time. Next thing we'll talk about in the last question, which is always a big problem, is in clinical practice, how do you address substance abuse in your patients? So it's a very touchy subject, and it doesn't matter which department you work in or what area of nursing you work in, you're going to see it. If you are an emergency nurse, you're going to see drug seekers come in all the time, frequent flyers, requesting specific medications. They have the long list of allergies of medicines that they're allergic to, and where they're trying to fish for the medicine of choice. ICU patients, you have a hard time trying to get them weaned off the ventilator because they are taking such medicines that abusing stuff at home, so therefore you have a really hard time getting them weaned off their pain and sedation medicines that are keeping them on the vent. On the med-surg floors, you're seeing patients withdraw from medicines there. They're staying on the call bell, really all day and all night requesting pain medicines. In the nursing home settings, don't let little old little old ladies, 80-year-old ladies for you. You know, that's they are not exempt from prescription drug abuse. Just because you would probably think they would bake you one heck of an apple pie doesn't mean they're probably not, you know, abusing drugs, prescription drugs as well. You know, and we're always taught that the patient is the expert on pain, and we should never assume that a patient is not hurting. You know, we need to take their complaints into account. But if we start seeing patients that have these signs and symptoms, the pathophysiological signs and symptoms, coupled with the history, the subjective history, like classic drug-seeking behavior, we really need to consult with a physician team and develop them a specific plan. We need to do our part as nursing to get them through their discharge into a 12-step program or a church group or trusted family and friends to do support therapy group, along with getting them enrolled in a pain clinic so they can get the treatment that they need, because they can't do it alone. They can't quit taking these medicines cold turkey. So it's important that we get them enrolled in some therapy as well as at a pain clinic to start getting themselves a pain plan to get the correct treatment that they need. Thanks, guys.